Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a healthcare system with 3 academic medical centers, or AMCs. Our AMC status means we have our finger on the pulse of the latest treatment and technologies in medicine, and we're bringing it right to our community. Throughout this podcast, we will discuss our health system service lines and the innovative work our doctors and professionals are doing to improve treatment and the patient experience. We will highlight our academic partnerships and the importance of creating collaborative relationships between health systems and educational institutions. And lastly, we will explore trending topics in the world of health today and what that might mean for the future of healthcare. I'm your host, Dr. Toni Flowers, Corporate Chief Opportunity and Social Responsibility Officer. Today, we are joined by Dr. Jeffrey Elder, Chief Medical Officer of University Medical Center, as well as an emergency department physician. Thank you so much for joining us today, Dr. Elder. Before we get into our topic, I'd love for you to tell us a bit about your background and your current roles at LCMC Health and at UMC.
Thanks for having me. So I'm a board-certified emergency medicine and emergency medical services physician. I currently serve as the Chief Medical Officer at University Medical Center, as well as an emergency physician at the hospital. And I also serve as an Associate Chief Medical Officer for the system with emergency preparedness and emergency management, as well as emergency medical services.
Yeah, and I want to say personally, thank you for all the help you did for our community during Hurricane Ida. That was my first hurricane, and you were just such a calming voice during that time. So that was very important. Thank you for that.
Thank you.
What many people outside New Orleans may not understand is that Mardi Gras is not just one day or even one weekend. It is an entire carnival season. Our population nearly triples in size during the peak. Now, as we're thinking about today being the beginning of Mardi Gras, how do local emergencies departments prepare for this influx?
So, for our emergency departments, this becomes just a big event for the city with lots of additional population, a lot of people out and about in the community. And so we have to be ready for those big crowds. And so luckily here in New Orleans, we're used to big events, big crowds. We have Mardi Gras, we have Super Bowls, we have football games, basketball games, big conventions that bring lots of people into the city. We have days like Jazz Fest and French Quarter Fest. So we're used to seeing these large groups of people in the city. And so for our emergency departments, we have to be prepared to react whenever anything happens. And for the big days of Mardi Gras, we just have to be ready for an influx of patients, not only the routine things like coughs and colds and trips and falls, but we have to deal with things like patients that are intoxicated because they've had too much to drink while on the parade route. And really the things that we worry about and that we have to be prepared for are large scale or mass casualty incidents. And so that's something that we always hope doesn't happen, but we have to be ready for as the emergency providers for the city and as the level 1 trauma and burn center for the city.
Sure. So what types of cases do you typically see in the ED?
So for Mardi Gras, typically we'll see, unfortunately, a lot of intoxication. We'll also see a lot of trip and falls. So whether it's people on a ladder who ultimately will fall off or just have a trip or a fall along the parade route. And then we'll see things that happen all the time, every day, that we routinely deal with, that we just have a higher concentration of people, so we'll see more of them. And those are things like chest pain, heart attack, and even strokes. And so we have to be prepared to take care of those patients from the route into our hospitals.
How is UMC uniquely equipped to handle these kind of situations? Is there any special training that the staff need to have to deal with these mass casualty events and with the huge influx of people in New Orleans during that time?
Yeah, so LCMC Health really plays a crucial role for the city. At University Medical Center, we're the regional level 1 trauma center as well as level 1 burn center. And at Manning Family Children's, we're the pediatric trauma center as well. And so for the most critically injured patients, we take care of them on a daily basis for this region. And when it comes to events like Mardi Gras, we have to be ready for that big influx of patients because we have a big influx of people in the area. And so we do have routine drills and tabletops that we perform for mass casualty incidents that get our staff and our team ready for if something happens, they're ready to act on a moment's notice. And so we do routine trainings, routine tabletops, as well as we utilize the system that we'll use for MCIs on a smaller scale on a more routine basis.
Okay.
So that everybody's ready and knows what to do.
That's awesome. That's really good to know. We should probably have that on our Travelers Bureau to know that we are ready for them, regardless of what may happen while they're here. Our care for patients extends beyond the hospital's walls during this time, too. Can you tell us about our partnership with the New Orleans Health Department and how we embrace that carnival spirit?
So LCMC Health is proud to be serving our New Orleans community this carnival season to ensure everyone's safety. Similar to previous years, LCMC Health is going to partner with the New Orleans Health Department to provide first aid stations along the parade routes. This means that if you get hurt or if you need other help, our people are right there to deliver care. Our volunteers are all CPR and first aid certified and are prepared to provide treatment for basic injuries along the parade route. And if something's more serious, they'll be connected with emergency medical services to provide that higher level emergency care that you may need. These first aid stations also offer useful supplies such as sunscreen, hand sanitizers, Band-Aids, and other things that might be needed when you're on the route. We even provide pop-up nursing pods for nursing mothers to have some privacy along the route. Many of our hospitals are conveniently located or just a few blocks off the routes. Manning Family Children's, Turo, and LCMC Health Emergency Care are near the Uptown Parade routes. University Medical Center is on the Mid-City route for Endymion. West Jefferson Medical Center is along the West Bank Parade route. And Lakeview Hospital will also be providing emergency services for any North Shore parade goers. One last unique thing that LCMC Health does that shows that we're not just committed to the community, but we're members of this community. For the second year, the LCMC Health 80s themed dance crew, Heartbeat, will be marching in some of our local parades.
Yes.
This dance crew is made up of physicians, nurses, and administrative staff and more. It's a great way for our employees to enjoy the season while still representing our health system. And finally, it's truly an honor for our team to give back to the city we love, helping our neighbors and visitors stay healthy so that they can focus on the joy and tradition of the carnival season.
Well, we've got them covered on every angle. As we wrap up and look forward to another joyous carnival season, do you have a favorite Mardi Gras tradition or parade that you attend?
Yes, I mean, obviously, who doesn't like king cake? It is the season. I'm a traditionalist when I think you should only have king cake during Mardi Gras season.
Gotcha.
But, I really do like a lot of the traditions that our Mardi Gras crews follow. And so there's interesting things like, for example, Rex on Mardi Gras Day, they cross over on St. Charles Avenue to do a toast on the other side of the street and make it back to the traditional side of the street. So it's those little things that I think the crews do and have been doing for decades, if not longer, that I think really make Carnival special. It gives each crew their own unique identity. And I just love to see it every year.
Yeah, something for everybody.
Absolutely.
Well, thank you so much for joining us, Dr. Elder, and thank you for listening. Join us as we go beyond extraordinary on the second Tuesday of every month.